I'm Betty Casey, editor of TulsaKids magazine, and I'm with Tia Claybrook, and Chantelle Lott. They're both with the OSU Center for Family Resilience at OSU-Tulsa. And I would like for one of them to tell you about what the OSU Center for Resilience is. So let's start with that question first.
Absolutely. Great question. I don't think that many people in the community know about us, but we are the Center for Family Resilience located at OSU Tulsa campus. And we work alongside agencies and organizations, different community partners, with the overall goal of discovering solutions for today's families. And we do that through different legs of the center, such as community engagement, research, education, and translation. And ultimately, we're just trying to be a community resource that's focused on equipping every system to support its members in achieving their fullest personal and social potentials.
Okay, thank you. It's good to know that that resource is here. I think it's sort of a hidden secret for a lot of us. So thank you for sharing that. We're going to talk about children and coronavirus and the quarantining and some of the issues surrounding how we can talk with children. So one of our questions is, with all the new information coming out, it's difficult to understand everything about the virus. So how can you explain, as an adult, how do you explain these complicated issues to children?
That is a very important question and valid question, especially these days as a question is things are changing. We would suggest first starting with, what does the child understand about what's going on with the coronavirus first? And also being mindful to use facts. There are a lot of opinions surfacing, and being mindful of that there are biases out there and with those facts. So just being mindful of opinions and biases as well. There are some resources that you can check to make sure that you're explaining the coronavirus to your child correctly. And that would be of course, the cdc.gov and also mayoclinic.org. They have some resources that will help as well. And if you don't know, it's perfectly fine to say, I don't know, especially again, as things continue to change. We don't want to give our children false information and then have to go back and change it. So if they know that we don't know, it's okay for them to understand that it's okay. Things are constantly changing as well. And also just reassure your child that they're safe. You're doing the best that you can to make sure that they're going to be protected and safe. And whatever methods you're using to hygiene methods, if you're wearing masks, and et cetera, just assuring them that that's what's needed to make sure that they're safe. There's also PBS has some great resources for talking to your kids about the coronavirus. And there is a book that I introduce my children to. It's called What You Should Know, What Kids Want to Know About the Coronavirus. And you can find that information out. It's uniteforliteracy.org, and we can post that in the chat. I'll actually do that so that parents can have that resource as well.
Great. Yeah, so using facts, making sure that we're not giving children misinformation, and those are great resources, Mayo Clinic, CDC, and I love the idea of having a book, and also PBS. So thank you for those resources. There's also an element, of course, of danger to this coronavirus. Obviously, they may have family members that have gotten it, like grandparents or elderly relatives, maybe even know someone in their family who has died. How do you approach that kind of topic with a child?
We think it's very important to definitely be sensitive around the issue. Approach it in a manner considering the child's age and maturity. If they've experienced death, there's no way around it but to talk about it. But if they're scared of someone dying, even if they haven't experienced it, just taking into consideration that there are people recovering from it. So it doesn't have to, people don't always have to die. So more people are recovering than are dying. So focusing on the facts that people are recovering as well. Also being mindful that we don't want, again, taking age into consideration, we don't want them to have nightmares about it. So just, again, being mindful. I think of it like when I was talking to my son, he's 8, he has asthma, and he already has a respiratory condition. So just let him know he can't go over a certain friend's house, but people can end up in the hospital. It doesn't mean that they're going to die, but they could end up in the hospital. And that was the takeaway from that conversation. So if it's death, we have to talk about it. But if it's not, then just being mindful that there are ways that people are coming out of this.
Yeah, so it sounds like putting those numbers in perspective. Sometimes we hear only about the deaths, but there are a lot of people who are recovering and a lot of people who are out there helping.
Yeah,
so, yeah, that's good advice. And I think you sort of talked about our next question about being honest with younger children using facts. I do have a question. How old is it? At what age can a child really understand what the virus is? I mean, it's invisible. You can say, if you have fire, you can say, there's fire, it's hot, it will burn you. This is something children can't see and adults can't see. So at what age can children really understand that?
Well, we've been dealing with viruses everyone's dealing with the cold, the flu. We talk about germs. So even in early childhood, as we're telling them to wash their hands and, wash their germs away, that can translate into very well what's going on right now. So just being mindful that there can be an understanding for even young kids as young as 2 and 3. We don't want to get sick. Don't put your hands in your mouth. Always wash your hands. Don't touch this, or, just different things that we're currently already doing. So as young as 2 years old, if they're able to understand the importance of washing their hands, then that should be able to translate into what's going on now for them, that we just don't want them to get sick.
Right. So they can understand sickness, because most of them have had a cold or something like that. So yeah, I hadn't even thought about that. Another question, we're a few months into this, and children's lives have been upended, as everyone's lives have been upended, and we're looking into the summer. A lot of the typical summer activities that children might do, or the places where they go to daycare, or I know the community centers are not doing their childcare this summer in the city. How do you talk to children about some of those changes, of things that they may have anticipated and then they're not going to be able to do?
Another good question.
Sorry.
I think we just need to be honest. We don't really know what's going to happen yet. There's still a lot of uncertainty, and we all want to get back together as quickly as possible, right? But we don't really know what's going to happen or when that's going to happen, and we need to be honest about that. Mm-hmm. But being mindful too, though, that we have experts that are always working around the clock right now on a treatment and ways that we can prevent having to do these social distancing measures that we're doing right now in the pandemic, and ways that we can get back into the public and back with our friends, and just really being honest is, I think, a great key to that.
Mm-hmm. Yeah, we don't know, but we do have each other, or as a family. Kids want to know, what is COVID-19? So here's a question from the chat.
I'm sorry, that was a link I was putting out.
Oh, okay, I'm sorry. I'm trying to read. It's tiny writing. Okay, so that's a link for, okay, thank you. All right, another question that I think came from a reader, and this is similar to the one that we just talked about. Some aspects of the state are reopening. It's still a mystery what schools will look like in the fall. How do we answer children who want to know when they will be able to see their friends and classmates again? And I think, I know I've heard a lot of people telling me that their children are disappointed that they can't be with their friends. How do you explain that to a very social child or a small child, and how do you sort of mitigate the disappointment of that, if you can?
Again, just being honest, we don't know. Things constantly continue to change, but there are ways that you can still stay connected. They can still stay connected. Again, people are meeting virtually now. If you have the parents' contact number of your child's closest friends, that would be a great opportunity for them to connect virtually as well. It's going to take some time. We tried it. It's kind of awkward, but at least they'll go to see some familiar faces. Maybe writing notes, if that's something, drawing pictures and mailing it. I mean, that would be something a lot of people don't get a lot of mail these days, but that might be something that to do as a project or something as well. But just going back and just being honest that we don't know when they'll be able to see their friends again in person, but just trying to make the best of the situation. And as things open, if you can go to an open park, like that still provides some social distancing, and it still allows kids to play. So just maybe getting creative and seeing how they could still see their friends in person, but it doesn't have to be in an enclosed place.
Right. So they can go outside, maybe ride a bike or do something while social distancing, but still seeing other people. Yeah, that's a good suggestion. Another question is that I think one of our readers had, what are some opportunities, and this may be part of what you were talking about, some opportunities for learning that the lockdown and the virus provide us? What ways can we turn the situation into a lesson about the world?
A great question. And I think that now is a great time to reflect on growth that we've had, even thinking about what are some things that we've been able to laugh about in this pandemic. What have we tried maybe that's new that we wouldn't have had the opportunity to try otherwise? Have we been able to learn anything about ourselves or about our children, or been able to reconnect with an old friend? We're all in a pandemic right now, right? And it's very traumatic for all of us, and we're all coping and going to deal with things differently. And I think it's important to remember that while we're all in the same storm, we're experiencing life hardships in different ways, which causes us to deal with things in our own way. And some of us are working from home, some still in the public. Some people aren't able to work right now. Some were financially stable enough to provide for themselves, and many were not. So just being gentle and understanding of others as much as humanly possible, and just remembering we don't have all the answers right now, but we are working towards them the best that we know how to do. And on the positive note, we're demonstrating what's called resilience, or the ability to face adversity and overcome it. And I know that we'll be able to take the lessons that we're learning from these experiences and apply them moving forward to best prepare for our future.
Mm-hmm. Yeah, I think as you were talking, I was thinking we all face some kind of hardship as human beings. This is an extreme hardship that we're all facing together, but that's part of human existence, is being able to go through, as you said, to move through that and come out on the other side. So I think that's a really good way to look at that, take that perspective and look at it that way. Yeah, thank you.
Absolutely. And, sometimes we need to reach out for support in other areas. And I think we need to be mindful about that and not be afraid to reach out for support, because so many of us need it right now.
Right. So if people are feeling stressed, or if their families are sort of at frayed ends, maybe talking to a professional or calling a professional to reach out. Yeah.
Absolutely.
I have heard some parents say that young children are more afraid of strangers because of social distancing, and they see their children having more difficulties with transitions, or because their schedules have changed so much that they're maybe acting out a little bit, and they worry about their parents' health. And I've also read some articles about healthcare professionals being concerned about the lack of socialization that toddlers are getting right now, and the emotional stress. So what should parents be alert to what kinds of signs might a child be showing that they're feeling maybe extreme stress, or how can they sort of measure the temperature, the emotional temperature of their child at times, to make sure that they're doing okay?
First, I think it's important that we understand that it is so natural for children to develop this fear of strangers right now during this pandemic, right? We're telling everyone to stay at least 6 feet apart. The aisles are marked for spacing and directions. People are suddenly wearing masks, and some people aren't wearing masks. And it's really hard for children to make sense of what's happened so suddenly. And young children especially have a very difficult time understanding that we're being more cautious for everybody, and not so much that everybody is infected and that we don't need to necessarily be in fear. So it's important that we're reminding our children very frequently about why we're taking precautions and being safe. We had mentioned the fire analogy earlier. You know, we tell our children not to touch the stove because it may be hot, right? They might be burned. But the stove isn't always hot, but it is sometimes, and we need to be safe about that. So also, while we need to be mindful about our proximity to others, we can always say hi and wave to strangers in passing, right? And that might help to alleviate some of that fear that our children have towards others, and helping us to remember that we're social distancing and not socially isolating. And then also, children will exhibit emotional distress in so many different ways, you know, depending on the child. Some children may regress back to previously met developmental milestones, such as bedwetting or baby talking, and that's a very common reaction for young children experiencing trauma. Some children may be acting out more, where you're finding yourselves having to redirect them more. Some children, especially older children, may be isolating more, spending a lot of time in their room, hardly ever coming out, maybe not talking to friends very much. Some children may seem a little bit clingier and more attached to adults than usual. And these are all different signs of distress. So whenever we notice these, we want to help our children to identify these feelings and also why they feel the way that they do, and reassuring them that what they're feeling is natural. You know, we're all having a hard time right now. It's very natural to feel the way that you do. And let's talk about these emotions and why we feel this way and what we can do so that we're not feeling this way right now. So thinking of ways that we can help the child to self-soothe, you know, blowing bubbles or drawing, maybe playing in the sand. These are all great activities that can help offer soothing for the child. And then also, as Chantelle had mentioned earlier, we want to talk to our children about what we as a family can do to help others through this pandemic, you know, by exercising different precautions, whether it's washing our hands, eating right, dieting right, getting enough rest so that we can stay healthy ourselves and we're not promoting the spread. And another thing is we want to be very, very mindful of what we're saying in front of our children and try to remain as calm as possible when we're talking about the coronavirus, and also be very mindful of our biases that we may have and different opinions that we may put out there, so that we're not creating any confusion. Mm-hmm. And also try our best to try to create and stick to a schedule or routine. You know, getting up at the same time every day, eating meals at the same time every day, maybe going to bed at the same times, and then scheduling time for activities and downtime in between. Because these schedules and routines help to make a day more predictable for children. And this consistency and predictability are huge key components to trust in our adult-child relationships. And we know from research that positive adult-child relationships are very promotive of healthy development of children. So just being mindful about our interactions with children and trying to keep a schedule as much as possible.
Mm-hmm. That's great advice. And being the adult, I know that some parents are sort of like, I can't do this anymore. You know, it's very exhausting to be with your child and be under stress. You know, parents may have lost a job, they may be worried. So reminding ourselves and being kind to ourselves about that as well can help. But I love what both of you said about framing that all of these things that we're doing that our children are doing, whether it's wearing masks, washing hands, social distancing, that we're helping everyone in doing that, and that's why everyone is doing it. So I think kids that would really appeal to a child, I would think. Yeah, that's such a good way to say that. So do you, what about, I do have one more question. What about watching television? And should we limit some of that, some of the information, because we're inundated with information?
I am so glad that you asked that question specifically, because we do want to be very mindful of the amount of TV time that we're allowing for our children, especially whenever it comes to the news and media on coronavirus right now. Being mindful that a lot of what the news reports, some of it is kind of skewed to try to make you believe and fear certain things, not necessarily purposeful, but some of the news and information we're getting from news outlets is a little bit skewed and not 100% true. And then also it reports more on the deaths and kind of the more negative impacts, obviously, of the coronavirus, which can increase that fear for children. So we definitely want to limit our exposure to media for children, especially. And if we are watching the news with our children, just again, being mindful of the different biases that could be out there, and then helping our children to find out what the facts are. Maybe doing some fact checking with the CDC website and different things like that.
Mm-hmm.
Yeah, and I would like to add, if they are watching TV, if it's, make it more educational, like PBS, everyone can get that in their homes, or just making it where it's entertaining for them, so that, because the news can have a way of draining us, even as adults, and kids will pick up on our feelings as well. Yes. So just being mindful, we need to kind of limit our interaction with the TV as well. So just being mindful that they will pick up on those negative feelings that we're experiencing. So how can we counteract that with some positive screen time?
Mm-hmm. Yes. Yeah, I know that I feel stressed when I watch too much news. And I need to watch something mindless sometimes too. So I know children feel the same way. And and we do, because it's the job of a journalist to give us sometimes some bad news. So it can be difficult and it can be draining. Do either of you have anything to add about just how families in general can work through this, or any advice as we move forward into this kind of uncertainty? I love the ideas and the resources that you gave for getting factual information and schedules with our children, and trying to remain the parent while we're maybe not feeling like we want to be parents. I know, if you have an 8-year-old, I'm sure that you have to, Chantelle, deal with a lot of questions and probably antsy things going on. So, things have changed for not just for children, but for us as adults as well. So do you have anything you'd like to add as a final thought?
I would just add something that we've done more frequently is family game nights, and that just takes the pressure and just takes our minds off of what's going on. We make it fun, so that's probably something we'll continue to do. But we just do more of it now, where we're conscious of making sure that that's what we're doing. Now, like what Tia mentioned earlier about taking those things, what have you laughed more? What are the positive things that have come out of this? And just doing those more. Just make it a habit of being happy or being joyful in these moments. What are those little moments, and how can we make them a big part of our life?
Yeah, absolutely. And then also too, being mindful that in addition to being kind to others and being understanding where they're coming from, we need to be kind to ourselves and understanding how we're feeling. And it's okay to feel the way that we do. We're all in a pandemic, and the nicer we can be to ourselves and to others, our children are going to see that, right? And they'll be able to pick up on that and ultimately start being kinder to themselves and a little bit more understanding.
I love what you guys are saying. So these are, it's a negative thing, but there are some techniques and some things that we can do that maybe will make us stronger as families as we move through this. So maybe that's a great takeaway, if we can work on those things. And I know my kids, Chantelle, used to maybe when we were doing something, doing a project, like playing a game together, they were more willing to talk. As you sit, do you find that as well, that your child will speak and talk maybe about what they're thinking more?
Yes, definitely. Even drawing, get just something mindless well, playing a game was not mindless, but the drawing part can be, but just doing activities, and then that'll kind of gauge what they're feeling. You can ask some questions and they will definitely open up.
Yeah, they're more likely to talk when you're doing something side by side. Yeah, great advice. Okay, well, I really appreciate you, Chantelle Lott and Tia Claybrook from the OSU Center for Family Resilience. And I think we'll have some resources, and we'll have this up on, we'll have this up on on TulsaKids site. So I really appreciate you being with us this morning and sharing your expertise. That was great.
Thank you so much for having us.
Thank you for having us.